This is an excerpt from an interview with Dr. Christian Kessler, who's a Western medical doctor as well as a scientist researching Ayurveda. He recently published a clinical trial that showed that Ayurvedic treatment outperformed Western treatment for IBS. Now, some of you may know Western medicine doesn't really know what causes IBS, but Ayurveda does. And so in this video, I asked Dr. Kessler about what Ayurveda views as the causes for IBS. I hope you find it useful. What's the Ayurvedic view on IBS? How is it caused? How is it treated? And how does that differ from the Western view?
Yeah, I mean, the fundamental difference is that from the perspective of Ayurveda, IBS is not so organ-centric and not so focused on micronutrients, etc. But the explanation happens more on a functional level. So in Ayurveda, two very relevant factors needs to be discussed when we talk about an Ayurvedic approach for what we call irritable bowel syndrome in the West. Of note, we do not always see 100% overlap between conventional diagnoses and traditional diagnoses. And that's a common misunderstanding, that we think, okay, it is called IBS in the West, and then there is a term in Ayurveda on Chinese medicine that is equivalent to IBS, sort of a Sanskrit word. And that's sometimes the case, that we see very close approximations. For example, in osteoarthritis, there is a term called Sandhigata vata, which relates well to osteoarthritis. But then there are different diseases where the overlap between diagnostic entities is not 100%. And that also relates to IBS. So we have to look at our patients, with the Ayurveda perspective. And that might give us different Ayurvedic diagnoses for people that would have the same Western diagnoses, for example, IBS, when they come to a conventional physician. So, and just to give you a few examples, from my perspective, and also in the in the Ayurvedic fraternity, when we talk about IBS, two things are almost always of relevance, and it's Agni, the principle of digestion and metabolism, and then the other big issue is a dysregulated functional principle that is called Vata dosha in Ayurveda. So usually one or the other, or in most cases both of these functional principles are dysregulated and need to be taken care of in a multimodality therapeutic approach. And but the constellation or the specific focus, what's more important in the individual case, might be quite different. And it might be that with one patient we work more on Agni, and with other patients we talk more about how we can regulate and then balance Vata driven process that is, responsible in that individual case for what the patients, the IBS patients experience per their symptoms. But nevertheless, Agni and Vata are almost always, a subject when we talk to our IBS patients. And
I see.
when we talk about Agni in IBS, it's usually a weak or an unstable Agni. So the digestive principle called Agni, and in Sanskrit, is usually not functioning well in IBS patients. And that's called Agni Mandya or Manda Agni, and that needs to be treated. And and that can be treated well, and then foremost with a individualized nutritional strategy, where the target is to enhance the function and the capacity of our individual digestive capacity that is labeled Agni in Sanskrit and in